And have you ever seen some people with normal testosterone level, but yet they still feel awful, And then there's also people with high testosterone that feel awful. So, would you like
Well,
to touch on that?
absolutely, I have seen it. I've seen that in terms of testosterone, in terms of thyroid, in terms of even having normal prolactin, yet having high prolactin symptoms, especially because of what you mentioned, which is the interconnection of everything. So, for example, if someone is on TRT, right,
Mhm.
testosterone replacement therapy, but their estrogen is too high or too low, that is going to make them feel miserable, even if their testosterone is in the optimal range, right? If their SHBG, sex hormone binding globulin, is too low, especially too low, I'm going to touch on the too high SHBG myth later, but if your SHBG is too low, you'll feel, for example, highly impulsive, uh, extremely aggressive, thinking about sex all the time, not being able
Mhm.
to think straight, thinking about violence perpetually, pretty much. Because have you ever experienced having low SHBG, Brendan?
Personally, I haven't had mine tested enough to know, but I do know that there's multiple causes of that, which uh,
No.
even varies depending on if you're on testosterone replacement therapy or not. But even something such as the liver function, can affect sex hormone binding globulin. But
Absolutely. And the paradoxical thing, well, I've seen it. It's not so clear in the literature, but having the liver affected can either give you too much or too little SHBG,
Mhm. And it can
which
also
is,
interfere with your thyroid hormone conversion as well.
yeah,
Your T4 to T3 through type 2 deadenase activity. So
no.
it can influence so many things in the body. So I mean, even having an optimal liver function is sort of essential if you want to have optimal hormones. So
Well, suboptimal liver function, suboptimal pancreatic function, suboptimal kidney function, suboptimal vascular function, brain injuries, all of those can actually hinder optimal hormone production. So, uh, of, you know, CTE patients usually have destroyed hormones, all
yeah,
because of the tauopathy going on in the brain, forbidding, because the hypothalamus, people think of the hypothalamus as the master regulator, and wow, so good. And that's great, yeah. But the hypothalamus works with the rest of the brain, you know, and working with the rest of the brain when the brain is perpetually shrinking in something like mixed martial arts fighters or boxers, that is going to cause your hormones to stay. Well, it won't be suboptimal initially, but over time, especially, there was I think it was Joe Rogan who's working with or heard of a doctor actually having great results in CTE patients just by treating their hormones. So
Mhm.
there is, to use a good metaphor for it. So let's say this was actually Leo's metaphor, rest in peace. If you have a broken leg, you know, you need a crutch, at least temporarily, in order to help you not walk on the broken leg and damage it more and more and more, and creating a vicious cycle where so the leg can heal crooked, because that happens. Same thing happens with hormones and brain injuries and even
of course.
pancreatic function, all of that. So hormones are affected by everything, and they affect everything in the body.
Absolutely. I mean, even CTE or any type of head trauma, like you'll often see immune suppression in those patients. And you may not think that has anything really to do with hormone production, but from my research into like thymus peptides, different peptides produced by the thymus, which would be inhibited under cases of CTE, those thymus peptides actually do have an effect on the pituitary and the hypothalamus in some ways that we do not completely understand. So, like, that's just an example of how interconnected everything can be. But I think also, you mentioned TRH at the start of this, Ali, and how of course, that's what stimulates the production of TSH for thyroid stimulating hormone for your thyroid hormone productions. But another thing that TRH does is stimulate prolactin, and that can inhibit dopamine, and that can reduce libido. And so, if you have a elevated level of TRH and you have low libido, that could be why. It could be because prolactin is high, even if your testosterone level is fine. And there's just so many things that can be interconnected that can play a role in how you feel with hormone optimization. But everybody's set point is also different, right? Like everybody has a different amount of androgen receptors as well as varying degrees of sensitivity to them. And I think also probably a varying amount of estrogen receptors and aromatase activity in their body, which influences the testosterone to estradiol ratio and so on, you know. So it's a complex topic, and I think that a lot of people who don't feel good despite having so-called normal testosterone levels, they really need to do some deeper exploration into their overall biology, you know, not just an overall complete hormonal panel of like testosterone free, sex hormone binding globulin, TSH, a T4, T3, you know, maybe reverse T3 and such, but like cortisol as well, and also just you know, overall functioning of all the organs in the body, from especially the liver, you know, and the other ones that you mentioned. And I think that is sometimes required, you know, in order to really figure out why some people aren't feeling good with so-called optimal hormone levels, you know, because I think a lot of people just don't get as advanced tests as they really need in order to you know, uncover the reasons for why they're not feeling the greatest.
If I had $1 for every time I heard somebody tell me when I want to check their thyroid function, and they'll be like, "Oh no, my old doctor said it was fine." I'm like, "Okay, well, show me. Could you show me the test that said it was fine?" And then you would look at, like, they would have a TSH of goddamn 4, and he's like, "Yeah, it's in the normal range. You know, it's not 5 yet, or 5.5 yet, so you're fine."
Exactly.
Well,
A
well,
lot of these ranges are not really geared towards like optimization, you know.